Okay, I think we'll make a start. So good morning, Bore da. My name is Claire Morgan and I'm Director for Carers Wales. So welcome to today's event. I'm really pleased to see that we have a really great number of professionals, policymakers, academics and unpaid carers on the attendee list for today on what is the 5th day of Carers Week, which is an annual opportunity to raise awareness of unpaid carers across the UK. So before we start, just to note that today's event is being run in English. However, simultaneous translation for the Welsh language is available. So you need to click the language button. I think it says interpretation at the bottom of your screen. Click on that button and it will give you the opportunity to hear the webinar today in Welsh. So today's event is a follow-up to the Wales Carer Summit, which we held in February. The online summit aimed to identify positive solutions and policy changes that could be made by statutory authorities, carer support organisations and communities more widely to make life better for unpaid carers. It was hosted by Carers Wales and funded by Welsh Government, as is today. Throughout the summit week, we had a number of focus group sessions which were held on a variety of topics, and those were co-facilitated with a range of relevant organisations to that topic. During the sessions, carers shared their experiences, but also their frustrations. We gathered evidence and then carers powerfully articulated how services should and could respond to their needs now and then into the future. So key points raised during the week were then collated and presented in the form of questions to a panel of health and social care experts on the Friday morning in a plenary session. So here we are today, 4 months on from the summit, and we're going to be hearing from my Carers Wales policy colleagues, Beth Evans and Jake Smith, who are going to give an overview of 4 of the focus groups that we held at the summit. And we've chosen those 4 because they were the topics that carers felt most strongly about. So we'll be talking through today hospital discharge, direct payments, and also really pleased that the Audit Office will also be helping to provide an update on that area of work, local government and complaints. So Jake and Beth are going to give a summary of the feedback we received from carers in those sessions. We're going to report back on the progress that we've made on the carers recommendations, and then we'll be talking about next steps. We'll then hear from some of the expert panel members who spoke at the summit in the final plenary session and hear what progress is being made on the commitments they gave that day. So just to be aware, I think that you will all have seen the message come up, but the webinar today is being recorded and then it will be available on the Carers Wales website following the event. If you've got any feedback as we progress through the session today, then please do note it in the Q&A button at the bottom of your screen, and Carers Wales will collate all of that feedback. So without further ado, I think we'll make a start, and I'm going to hand over to Jake for the first update on hospital discharge. So Jake, over to you.
Thank you, Claire. Let me just share my screen and we will begin. So, Bore da, everyone. Thank you all so much for coming along to this Carers Summit Next Steps event. As Claire mentioned, Beth and I will now be doing an overview of some of the most pertinent focus groups and workshops that we conducted in the initial summit back in February. We'll be telling you what carers told us, their suggestions, their ideas, but also their concerns as well. And we'll be updating on what we as Carers Wales have been able to do on some of these topics since, and what professionals have been able to do in these areas as well. So first of all, hospital discharge. This was, of course, a really, I think, a powerful and important focus group, because we know that for many carers, their caring duties can begin when a loved one is discharged from hospital and their needs may have changed dramatically compared to when they went into hospital. But also hospital discharge can be a point of real concern and also change of amongst unpaid carers when they potentially will be taking on new duties, new conditions to manage. And of course, it's so important that people are heard and recognised throughout the process. So the hospital discharge workshop was co-facilitated with the NHS Confederation and also with Victoria Deakins, the head of therapy and occupational health in Powys Teaching Health Board. In terms of the themes that were raised by carers, carers said that they needed to be identified by the hospital as soon as possible after the admission pathway has started. Because of course, we need to see carers being identified and acknowledged by professionals so they can be given the appropriate information, but crucially given the meaningful say in terms of the care and the discharge of their loved one. Carers also told us that healthcare professionals need to make sure that carers are being identified on the paperwork involved in discharge, because often it might just refer to perhaps family members or next of kin. But it's so important that the processes and paperwork used by hospitals are picking up that, you know, a carer is a carer for their loved one and they have that special role. Unpaid carers also told us that ward nurses, discharge nurses, and care coordinators need to be trained in carer awareness. They need to be aware of the legal rights of carers, the sort of information that can be useful, and the life experiences that carers will experience and that they should be aware of. Carers also suggested to us that there should be specific hospital liaison people or experts available to speak to carers in advance of the discharge to make sure that everything has been considered and has been put in place. Because otherwise, having a loved one discharged from hospital can be quite a sudden experience and quite a difficult experience if carers haven't been having that good communication with professionals, and if professionals haven't been keeping them in the loop. And a way to facilitate this would be having, dedicated and clearly identifiable people there to speak to carers to make sure that their needs and concerns have been understood and addressed. And we know, unfortunately, at the moment that there are significant challenges in sourcing enough social care support in the community. So this does unfortunately lead to situations where people might be well enough to be discharged from hospital, but there just isn't the social care available in the community to enable them to be safely discharged. So in those situations, rather than having an unsafe discharge and a person taken back to the home before it is safe to do so, carers said that it'd be really useful to have things like step down facilities, halfway houses, that would enable people in need to be discharged from hospital, but still have a degree of, care from the NHS and from professionals before they are returned home. And carers also suggested to us that there could be a specific department within hospitals to deal with any post-discharge issues. Because one of the themes that carers said to us really strongly was that it can often be a case of, discharge and forget. And carers will often feel that they're not being, communicated with and supported in the weeks and months after the discharge. So it'd be really useful if there were dedicated contacts or a dedicated department within the hospital that carers could talk to about any concerns as they adapt to caring for the person back in the home. So here's a few of some of the quotes directly from carers in the workshop. So one carer told us that there was no recognition or thought about whether a carer can cope, and that their loved one was sent home without telling them. And unfortunately, I think we are seeing this quite frequently at the moment. We know that there's immense pressure on hospitals to be discharging people out of healthcare settings and freeing up beds. But unfortunately, this does sometimes mean that people are being discharged really as a complete surprise to their loved ones and to their unpaid carer. Needless to say, this, of course, shouldn't be happening, and it's against all of the legislation and guidance. But unfortunately, it is a sentiment that carers felt they had to raise with us in the focus groups. Similarly, another carer talked about their loved one being sent home in an ambulance, but with no communication in relation to discharge and medication. And, I think that speaks to the importance of consultation and good communication throughout the process. Another carer told us that they struggled for 2 weeks before help was put in place. And another said that they were allocated care for the first 6 weeks, but after that, they never heard from anyone again. So it's so important that there's that aftercare and that good communication, even after discharge has taken place. So at the initial summit, we had Darren Hughes from the NHS Confederation here to take questions on the themes raised by carers and to give his reflections as the director of the NHS Confederation. And it's really good that Darren Hughes is actually going to be with us later on today. So he'll be able to give a bit of an update and his perspectives as the leader of the NHS Confederation. But in terms of what we as Carers Wales have done, since the summit took place, we were invited to give evidence as an expert witness to the Senedd Health and Social Care Committee when they were doing a inquiry into hospital discharge. And it was really well timed because it came after the summit, and it meant that so many of the points that carers had told us in the summit, we were able to raise directly with the Senedd members on that committee. And that inquiry, it was a really important inquiry by the committee, and we were able to directly feed in what carers had told us just a couple of weeks before. All of those points around consultation, information, identification. Another thing that we've been able to do in the months since is that our Carer Aware project, which is a project that's training social workers to be carer aware, we've created specific content, both within training and in printed resources, about how social workers should be supporting unpaid carers during hospital discharge. So we've heard what carers have told us in the summit and in other engagements that we've done, and we've created specific guidance for social workers, best practice. So if they have a role in hospital discharge, they're making sure that they're upholding the legal rights of carers, they're listening to them, and they're giving them the meaningful say that they deserve, and helping carers to liaise between social care and healthcare professionals. And the Carer Aware project is ongoing, so we're of course determined and committed to continue to provide that guidance and best practice to social workers. Okay, so I'm now going to hand you over to my colleague Beth Evans, who's going to take you through the direct payments workshop that we held. I think you're on mute, Beth.
Hi, I'm not quite sure whether you can actually see me because I can just see Jake at the moment, but I'll just press on. So, bore da pawb, good morning everybody. Just a little bit of context in relation to the direct payments focus group that we held back in February. So a mixture of individuals with different caring responsibilities from across Wales actually attended the focus group. Some came along because they'd never heard of direct payments and wanted to learn more. Others came along because they were in receipt of direct payments, but I had encountered various barriers and difficulties, whilst others who came along had direct payments and felt overall that generally, that they worked well for them when they were given more autonomy over how they were actually able to use them. I think overall, the group highlighted quite starkly the inequality in the way the direct payments are being administered across Wales, along with the disparity in the way that they can be actually used within the different local authority areas. Next slide, Jake. Okay, so the direct payments focus group was co-facilitated with the audit office, we had worked with previously. And some of the comments that came out from the carers at the focus group was there needs to be guidance for carers as well as social workers about what direct payments are and what they can actually be used for. So there was this confusion that arises between carers communicating with social workers about how they can actually use those direct payments to best meet need. There was also comments made that social workers actually need some training around direct payments, because when carers were questioning the social workers that they worked with, those social workers themselves were unsure what direct payments could be used for, and in relation to the different policies there are across Wales to enable people to meet their own personal outcomes and needs. Again, carers mentioned the inequality in the system as local authorities seem to be managing direct payments in different ways. And some are obviously using more flexibility than others. Some carers were receiving direct payments in their own right, as well as receiving carers allowance, for example. And the other thing that sort of was raised starkly with that there needs to be a uniformity of the rates and the consistency in policies across Wales. There's a huge issue in relation at the moment to the care market. We all know that, you know, there's a problem with the recruitment and retention of care workers. And they mentioned this and the need for there to be flexibility in the monetary value of direct payments to enable people to actually recruit and retain and offer attractive wages to personal assistants. So that was a huge issue. And I think, you know, given the current problems within that recruitment and retention process, it's getting even more difficult now for carers to be able to use direct payments to best effect. Okay. Another comment that came up was the carers felt that the disabled person's needs assessment should be carer blind, that there should not be that assumption that a carer is actually willing and able to undertake specific care needs. Social workers should not be assuming that the carer will cope, but if that carer also has eligible needs, then they should also be addressed. And if a support plan is in place, then that carer should also be offered direct payments in their own right. A lot of the carers who were in receipt of the direct payments generally felt they were good when they worked well and enabled that flexibility and more person-centred approach. Although some identified some barriers in relation to that, especially in having to go back and continually question what they could use those direct payments for and have that permission before they actually went off and sort of commissioned their own services. Some of the barriers identified as well in taking up direct payments, again, were concerns about being an employer, including all the administrative tasks and all the paperwork associated with that. A lot of the carers in the focus group didn't understand that, that an element can be built into the direct payments to enable them to employ somebody to sort of take that administrative burden off them. And again, carers in receipt felt when they worked well, they really worked well. So some of the quotes taken from the workshops were around the hourly rates being offered to them to enable them to commission their own PAs and services. I cannot find a carer for an hourly rate they offer, £9.79. It's £16.58 to employ someone through an agency. There needs to be more of an attractive wage to compete in the market. Again, we know that market out there is getting harder and harder. And quite a lot of carers as well, they're on benefits and they cannot afford to actually top up that hourly rate. They are therefore going without the care that they need. And again, the less hours that are awarded through a direct payment also makes it harder to recruit and retain staff. So for instance, if somebody is having a direct payment for 5 hours a week, it is really difficult for them to find somebody to take on that job for those 5 hours, because obviously people want to have more hours within work for their own personal reasons. Again, I've had a roller coaster experience with employing PAs, again reflecting the difficulties in the care market. There needs to be guidance on what direct payments can be used for. That was a huge issue, and confusion really over how they could best meet needs that were eligible within care plans. People who had some people said that they felt that the direct payments were brilliant and gave them back their voice, choice and control, that is so important and highlighted throughout the Social Services Act. And then another person said, I've been caring for my husband for 9 years and only heard of direct payments in the last 6 months, which is really concerning when direct payments, the offer of direct payments have been mandatory in Wales since 2004. So what has happened since? So we worked with the Audit Office prior to the summit to share carer experiences and facilitated a focus group with them to feed into their inquiry into direct payments. The Audit Office will be joining us shortly to update on the report that they have issued since the summit has taken place. Rhiannon Ivins is going to be addressing Welsh Government a little bit later on in relation to commitments that were made by Albertini. And obviously, we are going to continue to work with local and national governments to progress the matters in relation to the administration of direct payments. So hopefully there will be equity in the system and more carers will be able to take up the opportunity of meeting their own needs. Now I'm going to bat you across now to my colleagues in the Audit Office. Thank you.
Beth, I'm not sure that the Audit Office are on the webinar.
All right, they should be. I had an email off you, Ross. Let me check my emails 1 second.
It might be that they've come in under my name, Claire Morgan. There's a few participants, I think, who've come in under the name Claire Morgan. So we'll just double check to see if there's a way that people can rename themselves.
Right. Yeah, sorry, I've just had an email from you, Ross. So if you, Ross, Nick and Philippa can just raise their hands in the chat, or on screen. Other than that, I could probably run through the slides. Just 1 second. They can't unmute and they can't change names.
Hello, Beth. Can you hear me? Hi,
I
Beth. Can you hear me?
you. Yeah, I can hear you, Ross.
And you can hear me as well, Beth?
Yeah.
Hello, I'm Philippa from Audit Wales. Can you hear me?
Yes.
Lovely, thanks.
We're all here, Beth. Thank you. And yeah, we can't start the video for some reason, but hopefully you can hear me anyway. I think Jake's got our slides, haven't you? So yeah, but first of all, thanks for having us. Yeah, as Beth said, joined today by my colleagues Philippa and Nick from Audit Wales, and we're the team who coordinated the Auditor General's National Review on Council's provision of direct payment. And as a reminder, I guess for anyone who's not sure, that direct payments are monies paid to those who are assessed as being eligible for care and support, and are an alternative to council arranged care and support. So people receive money to arrange their own care and support rather than having their council making those arrangements on their behalf. And as Beth highlighted, direct payments are a way of very much improving voice, choice and control and independence for people. But there are some challenges around how they're provided across Wales, and that's a background to our review, really. Now, quite a bit has happened since the summit event on 7th of February, so very grateful for the opportunity to give you a brief update. And I think the first thing to say is how much we got out of the event. We undertake a lot of research for our reviews, but nothing really compares to hearing directly from carers about their experiences of using services. So a massive thank you from us. I guess the event in February, as well as the previous focus groups that Beth and colleagues had facilitated for us, they provided lots of information that we used as evidence in our final report, and that report conveys, carers very much face additional barriers in accessing and using direct payments. Now, we published a report on our website in early April, and we had a launch event as well with speakers from an organisation in England, Think Local Act Personal, to compare with some of the approaches over the border there. And we also heard some case studies from Powys and Flintshire councils, and also in response to our report, we had a policy update from Welsh Government as well. So that's a brief flavour of what's happened since. I guess Philippa, who's hopefully you can hear Philippa as well, she'll give you a quick flavour of the findings and the recommendations in that report.
Thank you, Ross. So our overall conclusion, as you can see, was that direct payments support people's independence and are highly valued by both service users and carers. So as Beth has previously said, when they work, when people with an eligible need can access them, they work well. However, people in different council areas are not always able to access the same services. So you can't directly compare the service people are getting from different councils. You can't tell if people are getting value for money from their direct payments. Can I have the next slide? Thank you. So in our report, we made 10 recommendations, which will be very familiar with from some of the aspects of this that Beth has been talking about. So one of our key recommendations was improving awareness, understanding and accessibility. So in other words, making it easier for people with eligible need to actually access direct payments. We also looked at improving capacity and availability of personal assistance. In other words, making it easier for direct payment recipients to find the right PA for them. We also looked at clarifying policy expectations to address the current postcode lottery. So in other words, all councils will have roughly the same idea of what they're expected to provide and then deliver roughly the same standard of service, obviously tailoring to different people as needed. We also made a recommendation around improving the interface between NHS continuing healthcare and direct payments. So this is for when people's conditions become too complex for social care to manage alone. We want them to be able to experience a completely smooth transition from moving between social care to NHS services. And for example, if they have a PA that they have a good relationship with, they're happy with, that they can, if at all possible, can keep that PA. Finally, we made a recommendation for councils to improve performance monitoring arrangements so that they can better demonstrate the impact that direct payments make and the value for money that they're getting from direct payments. So, for example, councils collecting more consistent data so they can better understand and improve how they provide direct payments.
Thanks, Philippa. I'll deal with the next couple of slides. So since we've published, what's really happened? So we've taken our report to the Public Accounts and Public Administration Committee, and that's provided that forum with the opportunity to challenge us in terms of the work we've undertaken, to better understand some of the difficulties within the current system, to highlight things that work well at present in terms of direct payments provision, but also to get a clear understanding of the service user and carer voice. And the members of the committee were very interested in the research we undertook, particularly the work we did with Carers Wales and the summit we held with yourselves to pick up on lots of information, but also the very detailed survey we undertook of carers and service users to understand the reality of it. So the committee's heard our findings. They're considering what further work they may take forward. They're also intending to refer on our work to the Health and Social Care Committee as part of their wider remit to ensure they can pick up on issues that we've flagged, and for that committee to consider whether they wish to be mindful of any further work that needs to take place. We've also had the opportunity at the end of May to meet with the National Care Service expert group who were involved in developing some of the work around the new National Care Service. And that allowed us to meet directly with members of that group to present information from our survey and our report, and in particular highlighting the difference between carers and service users' experience of direct payments, but also some of the issues that Beth has touched on and Eros and Philippa. We've also received formal responses from Welsh Government, ADSS and individual councils, which give us a sense of how the challenges we presented in our findings are being taken forward. And we're also looking to use and influence others' work in this area. So we've had discussions with the Equality and Human Rights Commission. Can you move on, please, Jake? So for the future, what else will be happening? So we know that Senate members, as part of their current remit, are considering in the autumn further inquiries. They may elect at that time to do a more detailed deep dive into direct payments, bring in Welsh ministers and Welsh Government officials and hold them to account for the system and how it operates. And obviously, knowing the committee's work, they will have a strong emphasis on the service user and carer voice. That's something that they're very keen to understand and pick up. There'll also be some opportunities for us to share our findings in the current evaluation that's being planned for the autumn of the Social Services and Wellbeing Act to ensure that some of the aspirations that were set out in that legislation are being delivered, and where things need to change to draw on primary evidence like our work and no doubt the work of Carers Wales to help shape that. We will also be feeding this review into our national and local risk assessments to determine whether we need to do follow-up work in the next few years, either at a national or local level. And then we're also planning to deliver some very specific outputs targeted service users and carers from our review to ensure that people who receive services have the opportunity to see what's happened since they helpfully participated in the work we undertook. So that gives you a flavour of some of the things we've got planned in the next few months. And if you move on to the final slide, please. And if people want to access our work, you can draw that down from our website. We have a press release that accompanied the report, and you can see where you can find stuff there. And I'll hand back to Jake.
Great, thank you very much, Audit Office, for that presentation. Okay, so excuse me. So another really significant workshop that we undertook was on local government, and it was a really well-timed workshop because it took place just a couple of months before the local government election. So we've seen, I think, really significant churn and change in the world of local government in the last few months. So it's been really useful to get some up-to-date feedback and sentiments that we could then feed forward into our work that's taken place in the months since. So the local government workshop that we conducted during the summit was co-facilitated with the Welsh Local Government Association, and the WLGA collectively represents all of the 22 local authorities in Wales. And carers told us in that workshop that local authorities need to be ring fencing carer funding and being accountable and transparent as to where that funding is spent. Because I think we picked up that there was a bit of a mismatch in the day-to-day experiences of carers and the pots of money that are announced nationally by Welsh Government, for example, for local authorities. And I think some understandable scepticism about whether that money was translating into real local improvements for carers. So because of that, there was a very strong desire for stronger monitoring and stronger accountability of where the funding is spent. But of course, there were huge changes to the delivery of local services during the pandemic, and not all of that was negative. Some of them were quite positive. So, for example, a few carers said to us that they found short and frequent calls with social workers to be really beneficial. And this was something that didn't really take place before the pandemic, but it was something that actually was felt to be very time efficient and just a convenient way for carers to frequently check in with their social workers and for social workers to be able to get those updates from carers. So there's definitely been some positive learning through the pandemic and maybe some practices that it'd be useful to carry on even after restrictions end. Unpaid carers also told us that there needs to be training for local authorities staff. So they need to feel that local authorities staff are aware of the legal rights of carers. They understand what it is to be an unpaid carer and some of the day-to-day experiences that they have caring for a loved one. Carers also told us that the carers needs assessment process, as so often delivered by local authorities, needs to actually hit some, key and really important elements, not least of which is emergency planning. So I think the pandemic has shown us, if it was ever in doubt, the importance of there being emergency or contingency planning. So if the carer fell ill, who would look after the cared for person? Who would be notified and what would be put in place? So carers told us that emergency planning needs to be a key part of the carers needs assessment process. And they want to see local authorities making sure that it is a key part of the assessment process. Unpaid carers also told us that there should be specialist carers officers within each local authority. There needs to be those dedicated points of contact that carers know exist in their local authority, that they can reach out to and that they can pay attention to in terms of their activities and their work within the council. Now, in many local authorities, there are actually already carers officers and dedicated staff members for liaising with carers and such. But carers need to know who they are. They need to be able to contact them. It needs to be transparent and open about who in the local authority has these responsibilities and where unpaid carers can turn to. Another really significant theme that came out of the workshop was around a postcode lottery. So with 22 different local authorities, all with different demographics, different political makeups, different sizes, you'll get those different choices about the delivery of services. But carers very strongly said to us that they wanted to see universal respite services across Wales with consistent eligibility and service standards, because it shouldn't be the case that people in one county have significantly greater access to respite and short breaks than those in a neighbouring county. And when Welsh Government, as they often do, announce funding for respite nationally, then carers in every part of Wales need to feel confident that actually that money will be delivered in a fair and equitable way across the country. So some of the quotes from carers from the workshop. One carer said, as carers, it doesn't really matter which public body is delivering it. It's what you receive that matters to carers. And this was a point around the integration of health and social care, and carers telling us that often there are artificial boundaries and bureaucracy that gets in the way of what should be joined up working between different agencies and different departments. Because at the end of the day, it's not about who's giving you the service and who's giving you the support. You just need to know that you are getting the service and you are getting the support. Another carer said, if somebody moves in a geographical area, it shouldn't need multiple assessments. So carers also told us that if, for example, they lived in one county and the person they cared for lived in another county, or if the person they care for moved within a different county, they were always having to tell their story all over again, have new carers assessments, fill out, more forms, more process, more bureaucracy. So carers really said there needs to be, that better information sharing, and it should be more seamless moving between council areas. And another carer raised training issues. So they said that the language around carers' needs assessments can actually be quite off-putting, and it can make carers feel that actually they're being assessed in terms of the quality of care they give. Maybe you could pass or you could fail the assessment, and actually it can feel like social workers and maybe the local authority will actually be judging them about the quality of care they receive. Of course, that absolutely shouldn't be the case, but unfortunately, the language is leading people to this conclusion. So that need to look at staff training and clearer communications. So in the summit back in February, we actually had the Welsh Local Government Association Health and Social Care lead, Susan Elsmore, responding to the themes and answering questions. Unfortunately, she is no longer in post following the elections, but we do have a video update from the WLGA that we're going to be playing you later. And we also had from the Welsh Government, Rhiannon Ivans. She will be reporting back later on today on behalf of Albert Heaney, the Chief Social Care Officer, about the commitments and the responses he gave in the initial summit. But what have we in Carers Wales done in the last few months? So we launched a manifesto ahead of the local government elections, which was heavily informed by the themes arising from the summit. So we used the feedback and the sentiments from carers to inform what we were then championing in the media and to candidates. And our manifesto, we called for service restoration. So the services that carers rely on are restored as soon as possible, for increases in the numbers of carers receiving assessments, and for good access to COVID tests. And the media coverage that we received of this helped to elevate the profile of unpaid carers in the local government election. We've also created a local government research briefing, which brings together all of our research into the performance of local government in supporting carers. And we're going to be sending that new briefing to all of the new elected councillors very soon. So every new elected representative will be hearing from us about the feedback that you've been giving us through surveys and through workshops, so we can get it on their agenda and they can understand carers' experiences. It's also useful to note that the Welsh Government have actually, back in April, launched a new short breaks fund. And helpfully, they are actually looking at a national coordinating body to try and tackle that postcode lottery. So hopefully it can be a bit more consistent. We at Carers Wales have urged all of the newly elected councillors to support Carers Week. So we're asking them to promote Carers Week, to make a pledge on the website. So we raised this important week with them, with all of the new elected representatives. As we've mentioned already, our carer aware training is training local authority employed social workers so we can improve their delivery of carers' needs assessments. And we're also planning to run a carer aware session for new counsellors on social care. So we will take every opportunity we can to be raising carers' issues with them. And now I'm going to pass you over to Beth for our complaints workshop.
Hi everyone, once again, just a little bit of context in relation to the complaints focus group we held. Again, this group came together from a mixture of different areas from across Wales, again with different backgrounds and obviously different caring responsibilities. They shared with us some really difficult experiences of raising a complaint or quite often a concern to statutory authorities, namely local authorities, local health boards, and in some of the cases, they felt that they needed to raise a simultaneous complaint to both, where they felt that they had been failed somehow within the system. A lot of the people in the group said that initially they wanted to raise a concern, but because of the inadequacy of the actual responses they were getting back, they felt that they had no other option other than to go down the formal complaints route so that their concerns could be properly addressed. You know, the difficulty with this is that when people are, you know, the carers told us they were battling within these sort of different complaint systems, quite often they were left floundering and in a limbo as to, you know, what they needed to do next, or they were lacking specific services. If you can go on to the next slide, please, Jake. So we held this complaints focus group with the Older People's Commissioner's Office. And what the carers said in the focus group were that they felt that the complaint timescales are not being properly honoured. It was taking excessive lengths of time for services to respond to the concerns or the complaints that they were actually raising. Now, this in itself caused various difficulties, especially if they were complaining about a service or a particular lack of service. And obviously then the pressure was actually falling back on the carer to actually meet need, whereby maybe, you know, local authorities should have been doing that themselves, or local health boards or whatever. They also felt as well there's a lack of advocacy out there to actually make a complaint or raise a concern, and to have that support is really important to them, because obviously for a lot of carers, you know, on substantial end of a caring responsibility, they are very time poor and they find it difficult to actually negotiate those various systems. They also felt that there was a lack of accountability and responsibility, and they felt very much that the system is there and exists to protect the professionals and not actually the service users. And they also felt that where they've raised a concern or a complaint, you know, there are no consequences. The complaints are either being dismissed, their concerns are not actually being acted on, and change isn't really happening to make something better for possibly someone else who is coming along behind them. They said they were also really worried about raising a concern or a complaint, because in some ways they may be penalised by the system. You know, they were concerned that by raising a complaint or a concern, that any services they may have been changed, they may receive a reduction in services, you know, and be penalised in some way for raising that complaint. And that was a huge barrier to them to actually do that, and a huge concern. And I think that's where sort of the advocacy, further information and that support would come in to support somebody through that process. Again, they said that they felt like the taking a complaint was a David and Goliath task. And I think that just really speaks for itself. And the trauma and the stress of taking complaints or raising concerns have had, you know, huge impacts on their own individual health and well-being. If you go on to the next slide, please, Jane. Okay, so these are some of the quotes that we heard from carers during the focus group. It's extremely difficult to get an adequate response, passed from pillar to post, sent 200 emails. So that just gives you a flavour of what some of these carers are coming across during the system of actually making that complaint. And I think this particular carer was actually dealing with a dual complaint. So not only were they dealing with a complaint against the local authority, they were also dealing with a complaint again against the local health board, which obviously had, you know, forced real difficulties on them in getting answers from each element of that complaint. Another carer told us that they still had no resolution 2 years on from taking that initial complaint. People mentioned, as I just previously alluded to, was they had trouble actually getting the complaints form together. And they actually went to a local community council for help, health and community council, sorry. And that's all they did was send them the form to complain that they already had. And that's not what that person wanted. They actually wanted support and that advocacy to help them to formulate the complaint. Again, the next quote, no professional help, there isn't any. I was told to raise complaint if I wasn't happy with the answers, but they haven't had any answers. So again, they've raised that complaint, but they've had no answers to what they raised with that particular authority. And a lot of carers felt really intimidated, either by the person they were dealing with or the actual system in relation to taking that complaint, and worried about being penalised in some way. You know, the David and Goliath task, dealing with one individual, dealing with, you know, a whole system, felt very intimidating for them. So if you can just go on to the next one, more quotes. Some staff told an individual to complain, and because those staff had told them to complain, they did actually feel supported within that process. A lot of the carers felt that they didn't want to make a complaint, they just wanted to raise a concern. But ultimately, everybody, you know, within the group, I think the whole ethos was that they wanted lessons to be learnt so that other individuals wouldn't have to go through the different things that they were experiencing. And again, the need for accountability and responsibility. So if you go on to the next slide. So what we've done since. So Rhiannon Ivins from Welsh Government will be addressing the summit in the expert panel in relation to commitments that were made at the actual summit. But what we have done, we've now had a discussion with the Ombudsman's Wales office with a view to influencing them to take an own initiative investigation about how complaints are being handled across the board in local authorities and health. Since the summit, we have also issued a survey monkey to gather further experiences from carers into the complaint system. And at the last count, the scores on the doors were that we now have over 50 responses to that survey monkey from carers that we will actually disseminate the information from, and we will use to make a case to the Ombudsman, as well as sharing that information as well with colleagues in Welsh Government and through the Welsh Local Government Association and through local health board colleagues where they relate to complaints against health. We will be facilitating a focus group with carers and the Ombudsman's office in the very near future, so that they can hear directly from carers about the experiences, you know, that they have had directly. So that's what we will be doing as Carers Wales. And now I'm pleased to hand back to Claire.
Thank you, Beth. So as we said, really the feedback that's been given today is just a snapshot of some of the things that have happened since the summit 4 months ago. It is very much live for us as a team. We are focusing on what carers told us and looking at the various ways that we can push this forward. Obviously, some of those covered by Beth and Jake, but just to say, it is a moving task, and we continue to focus on what carers have told us and try and instigate the change that's needed in those areas. So thank you to Beth and to Jake, and I'd like to say a massive thank you as well to our audit office colleagues for coming along and providing those really helpful updates on the inquiry work they've done around direct payments. It's so helpful to have that independent voice looking at this as well. So thank you for coming along today. And as you will have seen from the report that we produced after the summit back in February, there were additional areas that were also discussed, and they were things like the National Care Service for Wales, home adaptations and aids for carers, skills for unpaid carers, and support for working carers, so those who are balancing work and care. So I just wanted to say, obviously, Carers Wales continuing to work on all of those areas discussed at the summit, but we pulled out those 4 key areas as key areas that we needed to focus on because of the strength of feeling from carers who came along to the summit. I would urge you, if you're not already, to become a member of Carers Wales or to join our e-bulletin distribution list, and you can do that by contacting us, and we will add your name to that list. As members and people on the e-bulletin distribution list, you receive regular updates on all of our work, and obviously our work in taking forward the work around the summit as well. So please do join if you're not already a member, or join the e-bulletin list. Okay, so now we're going to move on to the expert panel, and we're going to ask them to give some feedback on the commitments they made back in February. We are going to ask each of them in turn to give us some feedback, but can I just ask all the panel members to just mute themselves when they're not speaking, please? Firstly, I'm just going to introduce each of them, and then I'll ask them one by one to speak. So firstly, can I introduce Darren Hughes, who's Director for NHS Confederation Wales, Rhiannon Evans, who's Deputy Director with responsibility for carers at Welsh Government, John Day, who's Assistant Director for Social Care Wales, who's representing Sue Evans today, who's the Chief Executive and not able to make it today. So really pleased to have John come along. Also, Helen Walker, Chief Executive for Carers UK. And as Jake alluded to earlier, as yet, the spokesperson for the health and social care for the WLGA, the Welsh Local Government Association, has not yet been appointed following the May local elections. However, I'm pleased to say that we do have a short video to show from Stuart Blythe, who's from the Welsh Local Government Association. So we shall be sharing that in a little while. And also, as mentioned earlier, we've received apologies from Albert Heaney, who's the Chief Social Care Officer for Wales, but really pleased that Rhiannon will be providing some feedback on his behalf as well. So since the summit, we've met with and had discussions with all the expert panel members about the commitments they gave. We've discussed practical ways that they can move forward the commitments they gave and the support that we can provide at Carers Wales to help them do that. So first of all, I'd like to start with Darren Hughes from the NHS Confederation for Wales and hear his feedback on the work that he's done since the pandemic, since the summit, and the work that he'll be doing following on from today. So Darren, thank you for being with us today.
No problem. Bore da, good morning, everyone. Sitting and listening to the presentations from colleagues was just a sort of reminder, and took me back to February, where all of us on the panel who were there last time had the opportunity to hear firsthand from those of you who were providing care and have an interest in this. And always in these sorts of presentations, it's the direct quotes that really sort of hit home to me, is how important the work that carers do are, and what all of us have responsibilities for in the NHS and in the care sector, to ensure that we're doing all that we can to support you and enable you to do and to provide the best care that you can. I think a couple of things sort of hit home to me again, and Claire inadvertently mentioned the pandemic, even though she didn't intend to, but you know, all of us have been affected, the NHS, the social care sector, and all of you, by the wide-ranging effects of COVID, directly and indirectly. I think what I committed to at the last meeting back in February was, there's definitely a recognition, I think, from all of us in health and social care that we need to do much more to work more effectively together. I think in Jake's presentation earlier, we heard feedback from a carer that as a carer, you don't care who the support is coming from, if from which council it's coming from which local health board it's coming from, or you don't really care about the sort of division of who's responsible for which bits of it. I think the important thing is that we're all working together as statutory bodies to ensure that we're working seamlessly and ensuring that those in receipt of care and those of you providing care are getting all the support that you need. We've met with several of the colleagues around the table, Welsh Local Government Association, the Directors of Social Services as a group, and I know health boards locally across Wales in their geographical areas have been working very closely with councils on the ground and highlighting lots of the issues that were raised at the last summit, and in the excellent report that Claire and colleagues have put together on your behalf. I took back the concerns to the chief executives of all the Welsh NHS bodies that we meet on a monthly basis. I took back the concerns immediately after the last meeting, particularly around the identification of carers during the hospital discharge process. And I think Claire had sort of fed back, and it came back in the feedback from individuals, that often the next of kin might be identified on the sort of formal paperwork, but the carers and the amount of support and things that people are going to be needed are not always there. So my colleagues in the NHS have committed to take that away and to see what they can do to help with more of this stuff. On the health and social care side, I'm sure you'll have read recently and seen on TV and heard on the radio that the sort of pressures within the system are still as severe as they have been at any point through COVID. One of the big challenges for us in the NHS, but also for colleagues in local government, is workforce retention and workforce recruitment. And unfortunately, the vacancy rate in social care across Wales is very high, and unfortunately, this similar position in the NHS. But I'd just like to assure people that we're doing all that we can to encourage people to come and work in the NHS, to work with you, to support you. But we are facing a very challenging time at the moment. The information that we heard at the initial summit back in February was a sort of key part of, similarly to Carers Wales, we submitted evidence to the Assembly Committee. You were looking at hospital discharge. It was excellent for us to be able to cite your evidence and the work that you've done to try and ensure that members of the Senedd understand how important the work that you all do is, but also what the challenges we are facing in the NHS and colleagues in local government to support all of you. So we've looked at that. And I think for me, if there was one thing that we need to do is, I think that sort of when people come into contact with the NHS, if that's in primary care, your GP, your community pharmacy, that the role of carers is more prominent and more understood. So, you know, we've raised that in executive peer groups. That's a technical term, but it's a sort of where all the lead GPs, pharmacists, nurses for particular areas get together. You know, we have raised the issues that were raised at the last summit and were highlighted in the paper and in the follow-up panel groups. And I think for us, it's just really a commitment to continue to work with Claire and colleagues and all of you. And, you know, please do. It's very frustrating, I'm sure, for all of you, the issues around raising of complaints, and, you know, things weren't obviously going as well as they should be in that area. And again, you know, keen to, after this meeting, follow up with Claire to see if there's anything we can do to support that. I know that community health councils were mentioned. We sort of work closely with those, and community health councils are in the process of becoming a new body called Citizens' Voice, which will be able to speak up on behalf of individuals and carers across both health and social care, whereas their current remit is, you know, technically just on healthcare. So again, you know, the door is open. I'm keen to continue to engage with you. Please do you know, feed information into Claire and colleagues, and we'll do all we can at the Welsh NHS Confederation to support you, but also committed to working with everybody involved who can make a difference on your behalf.
Thank you, Darren. That's absolutely brilliant, and really appreciate that ongoing commitment and renewed commitment. So thank you. Just conscious of time, so I'm going to move straight on to Rhiannon from Welsh Government. So Rhiannon, over to you.
Bore da, good morning. Can you hear me first of all?
Can hear you loud and clear.
Lovely, thank you. Bore da, diolch yn fawr am y gwahoddiad y cyfle I wneud y cyflwyniad yma heddiw. Thank you for the opportunity and invitation to speak today following the summit that was a real eye-opener back in February, and obviously following your report. Without repeating the words of Darren there, it's obviously been an excellent piece of work that we've been very interested in, and we've taken the time to obviously look at the results and see what more that we can do. As you've already said, Claire, Albert Heaney, CBE gives his apologies, but he's asked me to update on a couple of his areas as well as my own this morning. So at the event back in February, he committed to continuing to work collaboratively across government and with partners and stakeholders to achieve improvements. And he's made, I think he said back then, but just to reiterate, he's made unpaid care as one of his top priorities as his role as Chief Social Care Officer for Wales. And he's also made a short video about that this week during Carers Week, which if you're interested in seeing, it can be viewed on the Welsh Government Health and Social Care Twitter account. He's also been looking specifically at direct payments and carers needs assessment, which we've heard much about already this morning. And he was really interested to read the comments as well coming from the summit, as I say, back in February, and how they actually reflect some of the evidence that came from the recent Audit Wales report we've also heard about this morning on direct payments. A significant number of the recommendations for the report were directed to local authorities, and Welsh Government has since published our response addressing two key areas. Firstly, supporting choice, and is a direct payment the right solution for the person concerned? And secondly, supporting people to manage their direct payment, which includes achieving an effective balance between their autonomy and governance around public funding. So on supporting choice, we've already started our discussions with local government about how we can secure greater consistency in terms of awareness and understanding around direct payments. As we've heard this morning, not everybody unbelievably is aware that they exist, and we need to do something about that. It's agreed that having clear and consistent information is absolutely critical to that. So we need to ensure that people are being consistently signposted, as it's clear there's some gaps between partners that still need to be addressed in that area. So our continuing aim with all of that is to provide simple and concise public information. So in very quick and simple terms, direct payments are a choice, they're not suitable for everyone. So if you don't think they're suitable for you, you can say no. But obviously we'd encourage everybody to fully explore the support options available before they do that. You can receive support to manage your direct payment, and Audit Wales evidence, as they mentioned, they touched on briefly earlier, does actually indicate that 78% of people where they did receive direct payments said they received good quality support. So that's positive. There are some excellent real life examples showing how direct payments have been used in Wales, with which local authorities and others, such as the All Wales Parents and Carers Forum, have published on YouTube. So I'd encourage you to have a look at that as well. And we know that there are difficulties, though, with pooling direct payments to meet outcomes, because they can sometimes be quite complex where employment legislation is relevant. So we're exploring options to help address some of those problems. And finally, then, on direct payments, we're really pleased that the Audit Wales report confirms our aspirations that direct payments can really make an important contribution to meeting an individual's care and support needs, and that they're highly valued. So that continues obviously to be reflected in all our planning for the future of social care. I'm moving quite quickly, I hope that's okay. On carers needs assessment then, we're taking forward a number of actions following the publication of our strategy of unpaid carers and the delivery plan. We'll be using the data we collect through the evaluation of the Social Services and Wellbeing Act and the revised performance and improvement framework to work with the local authorities to develop a range of solutions that will hopefully help them to deliver timely, effective statutory assessments that are responsive to individual needs of unpaid carers. We'll also be using the findings from the research that commissioned by Welsh Government, the Public Health Wales Data Development Project, and the data from the Performance and Improvement Framework to determine what specific actions are needed to improve the take-up of carers' needs assessments. And we'll also be working with Social Care Wales and local authorities to look at what further guidance and resources are needed to support the social care workforce with delivery of those assessments. And then if I can just move on to my commitment. So I agree to have a look at the existing complaints processes and mechanisms, and as you know, complaints departments should really be a front door service and should signpost to the relevant routes for challenging those decisions where concerns have been expressed by individuals. So to respond to that, I've engaged with officials working on the Health and Social Care Quality and Engagement Act to ensure that the Citizens' Voice body, once it's established, is available to provide complaints advocacy to users of social care services. We'll also shortly be writing out to directors of social services, reminding them of the statutory requirements, because they are there already, around complaints handling and the relevant timescales. And we'll also be holding a meeting specifically with local authority social services complaints officers to discuss current issues and the feedback and concerns we've heard via yourselves, Claire, and you know, from unpaid carers about their concerns with the complaints process. Social Care Wales are leading on looking into themes and trends around that they've from directors of social services reports, and they're looking at new guidance which is being scoped for directors around this, particularly with regard to perception, or the perception by some, and we've heard again that this is still out there this morning, that some people believe that they may somehow be penalised by the system, in inverted commas. So that's important to address. It's also worth mentioning that there's an ongoing European Human Rights Commission inquiry into challenging decisions about adult social care. So of course, we'll be really interested in their findings and any recommendations they make. And indeed in the findings from the Care as Well survey you've launched, Claire. So, we'll certainly be interested to see what that comes up with and what more we can take forward from that point. Once again, I just say thank you for the opportunity today, particularly during Carers Week, and obviously for the opportunity back in February to listen directly to carers via yourselves and their feedback. So I hope that's been a helpful update this morning. Thank you very much, Claire. Diolch yn fawr.
Thank you very much, Rhiannon. It's really excellent to hear those really specific comments that you've made around the actions that you're going to take, and we really appreciate that, and we'll be obviously keen to work with you to see those through. So thank you.
Thank you.
Okay, we're going to head to John Day now, who's Assistant Director at Social Care Wales, who'll be feeding back on the commitments that Sue Evans made at February Summit. So John, over to you.
Thanks very much, Claire, and bore da pawb. Yeah, as Claire said, I'm here representing Social Care Wales on behalf of Sue Evans, who unfortunately is interviewing today. So I just want to give an update on some of the actions that we're currently taking that Sue committed to back in February, but there's some other things I just wanted to touch on as well. So one of the key things that we're looking at internally as an organisation who employs staff ourselves, obviously, and as a growing organisation, we're reviewing our policy infrastructure so that it's reflective of the needs of carers within our organisation. And Claire has also kindly offered to deliver a lunch and learn session for our staff, which will be built into this year's learning and development programme for the organisation. And in addition, again, thanks to Claire, we've included a session as part of our board development day as well, so we can make sure that the coverage of raising awareness around carers is placed at board level as well as organisational level. We've started initial conversations about next year's accolades in general. This year's accolades have only just been awarded in April. So our recognition of the work that goes on in the sector is an annual event. And we've already discussed putting forward a new award that recognises professionals and their work with carers, so that we can begin to highlight and share good practice in this arena as well. So those decisions will be made about what awards we go forward with next year towards the autumn time when we go out for nominations. We've also been giving ongoing support for the carer aware training, which Beth has touched on this morning, aimed at social workers. And we've done this in a couple of ways. One, in terms of sitting on the advisory board for this work, as well as consistent promotion for the training through our weekly digest, reminding people of the events, which will go to all registered social workers, and also its direct promotion through the workforce manager network as well, particularly indicating where low attendance takes place. We've also, for some time, under the old carers measure, but also refreshed it then with the new legislation that came in under the Social Services Wellbeing Act, an e-learning product for raising awareness of carers that applies to all social care staff. And we've now managed to place that on the Learning at Wales site, which is a NHS platform, which we have a microsite on. So that's now available as a single sign-on to all social care workers, so they can better understand their roles and responsibilities around carers, but also around the recognition and identification of carers as well. We have 3 workforce plans that are due to be published in the next few weeks. As the regulator for the social care workforce, we're expected to also look at supply and demand needs within the sector. So those 3 areas are: one for mental health, which is a joint piece of work with our health colleagues in Health Education Improvement Wales, one for the social work profession, and then one for the direct care workforce as well, which covers everything from domiciliary care, residential care, day services, supported living, personal assistance, and foster care. And all 3 of those workforce plans have clear commitments to the continued support for carers and ensure that they're considered as part of the developments that will not only support the workforce, but also carers and families themselves. And the last thing I wanted to pick up on was a commitment that Sue made to review how our qualifications cover the carers and volunteers' needs as well. Through our qualification framework, we've undertaken a huge piece of work over the last few years to revise all our qualifications from levels 2 to 5 in the vocational arena. And that process was supported by a wide range of representatives across the health, social care and childcare sectors. And this included overarching networks for each of the topic areas. So, for example, Learning Disability Wales contributed to the Learning Disabilities Agenda, Fostering Network to Fostering Awards, and so on. And so other areas such as Age Cymru, Sense. So the networks were asked to both cascade the information to their relevant networks and stakeholders and bring feedback from the groups they represented. And in addition, you use current reviews or reports to inform the work, such as the Older Persons Commissioner's Report, Place to Call Home. The level 4 and level 5 mental health content particularly had a fairly wide-ranging sector group. And again, we have representatives from carers, organisations, and people who use mental health services to help us develop those awards. And it was essential that right across level 2 to level 5, we involve people with a lived experience and using services to be part of those group. In terms of the qualifications themselves, then we've integrated carers into all of the main units and qualifications at level 2, 3, 4. And we've also taken this approach at level 5, but we also have 2 specific units at level 5, which is about leading and managing support for carers and leading support for carers. The coverage of the work with carers includes elements of the Act, so the Social Services Wellbeing Act, and where this fits in to each qualification and level. So hopefully that gives you, a clear indication of what we've done specifically since February, based on the commitments that Sue made on behalf of Social Care Wales, plus another key areas, but also that reassurance in terms of the way I've covered the qualifications towards the end, that we are making sure that our training and learning and development that is accessible by the workforce is absolutely centred around the work, the needs of not just the service users and those receiving care and support, but the carers and families as well. And again, like everybody else, just thank you for the opportunity of attending today and to give you that update.
Thank you, John. That's really brilliant, and it's I think really pleasing to hear the integrated approach that Social Care Wales has taken, not only across the staff but also right the way through your work, ensuring that carers' needs and rights are across everything that you do. So thank you for that really helpful update. I'm now going to show a video which the Welsh Local Government Association has shared with us for today. So all being well, I'm hoping that this will work and that I will be able to share the video with you all. So hopefully you can see that, and I shall press play.
So, good morning. My name is Stuart Blythe, and I'm the Welsh Local Government Association's Policy Officer for Social Services and Health. For those of you who might not be aware, the Welsh Local Government Association, or the WLGA, is the representative body for the 22 local authorities in Wales. So just to start with, thank you for the invitation to take part in your webinar today. And I'm sorry that I can't be with you live, but it's still great to be able to follow up from the summit that was held earlier in the year, and in particular reflect on some of those discussions that were focused on looking beyond May 2022 and the role that local government can play. How we can all better support unpaid carers, I think recognising the devastating impact that the pandemic has had, has been and is one of the key priorities that our local government members have frequently highlighted. This came out from discussions that our lead members held with ministers and with Welsh Government officials, in particular in the lead up to this year's budget announcements, where our members were clear that there is a critical need not only to just invest in social care, but to really make a clear case for greater investment in services and support for unpaid carers. And local government remains keen to work with Welsh Government, with carers and with carers organisations to help ensure that we are all doing all that we can so that carers are fully supported and signposted to services to avoid carers and families reaching crisis points and care breakdown. Whilst the local government discussion during the summit was framed around a post-pandemic world, unfortunately it's important to recognise and acknowledge that local authorities and in particular our social care system continue to be under considerable strain. It was under strain before the pandemic, and the pandemic has only exacerbated it. And unfortunately we anticipate that the impact will be felt for some time to come. I'm sure that many of you in the room or around the screens will be aware that we've recently held the local government elections. For us organisationally, it's caused a fair amount of disruption, but we're now in a position where councils are being formed and new cabinets being created, so things are starting to settle down. And this will be the first time that we will pull the 22 new local authority leaders together for the first time. Around that table, because I think they'll be meeting in person for the first time as well, there will be some familiar faces, but there will also be a number of new faces in there too. Some will have a vast array of experience of local authority and local government working. Some will be fairly fresh-faced to it. So from here, WLJ will hold its AGM at the end of June. From there, we'll know what the political leadership of our organisation looks like. And from that point, we'll be engaging further with our leaders, with the cabinet members from all local authorities, which will help to form what our WLGA priorities are. This will then include further engagement with our members and importantly with ministers to outline what we believe local government's priorities are and how we want to work with ministers to take these forward. But there's already, I suppose, a number of things that we do know. We know from early engagement with our members and from our discussions with local authorities prior to the elections and in recent weeks that social care is and will remain one of the biggest priorities for local government. And prior to the elections, we highlighted the importance of social care in its own right and the need to invest in it and place it on a sustainable footing going forward. Central to this is supporting the workforce and recognising the essential role that unpaid carers play, with a need for greater resources and support to be made available. I'm sure some of you will be aware that local authorities are supporting with the £500 payment to those unpaid carers in receipt of carers allowance. One of our consistent calls has also been around the need for greater parity with the NHS, and this is something that we believe will help support greater integrated working across health and social care. And I know this was an area that came up quite strongly from the summit earlier in the year. We know that the most effective services are those that have been developed in response to local priorities, shaped by a strong carer voice at the local level and supported by proactive partnership working between health, social care and the voluntary sector. And I'm sure this is something that our members will continue to be keen to reinforce. On a national level, we know that there's a significant amount of work happening at the moment as well. So Welsh Government has started work on their rebalancing programme, which has led out from their recent white paper, which was aimed at improving social care through strengthening partnership working and integration of services. So some of the areas that includes is around the creation of a national framework, creating a national office and strengthening regional partnership board arrangements. So there's a number of work streams that have been established and local government is engaged in this work and will be keen to influence how it looks and how it works moving forward. In addition, along with many of you around your screens, I imagine we await the recommendations from the expert group that's been established to consider the creation of a national care service. And local government is going to be keen to engage with this work at the earliest opportunity and again help to shape and influence that. There is much going on and so many pressures at the same time. And as we pull together our political leadership and engage with our new leaders and our new cabinet members, we will be keen to ensure that we continue our conversation with unpaid carers, working closely with Carers Wales, looking at how best local authorities can support and improve the well-being and rights of unpaid carers in recognition of the vital role and the significant contribution that carers make. Thank you for your time, and I look forward to hearing more about how today's webinar and discussions have gone and working closely with Carers Wales to help take some of this forward. Thank you.
Okay, so conscious of time, so I'm going to go straight on to Helen Walker, who's Chief Executive of Carers UK.
Hi there, everyone. I'm also very conscious of time, and I also found this slightly more challenging as I'm not a decision maker. So my commitments really focus on what we are and continue to campaign for at Carers UK. Specifically, at the summit, I spoke about the importance of a social care service fit for purpose to enable people to remain in work and or return to the office in this new hybrid working that we have. The importance of flexible working from day one and the introduction of 5 days carers leave, which was a manifesto commitment of the Conservative Party. And I can tell you that we were beyond disappointed not to see carers leave make the Queen's speech for this next year. And we've made that very clear to ministers. The best commitment that I can get from those responsibles is that it remains a government priority when parliamentary time allows. We're currently looking at options for a private members bill, but it's a long shot. Meanwhile, we're proactively encouraging our employers for carers members right across the UK, particularly here in Wales, to lead the way. Many already give paid care leave and will argue that it makes very strong business case because it stops people calling in sick or taking holiday in order to take the person they care for to hospital or feel less pressure when that inevitable emergency happens. Having an employer who is flexible and understands makes such a difference. It improves retention, loyalty and commitment. And in this extraordinary period where recruitment and retention, and Darren just mentioned it in terms of social care, are the biggest challenges for anyone who's running any type of organisation, why wouldn't you put carers leave in place to support those carers in your workforce? In terms of the importance of sharing learning of good and bad practice that I committed to right across the UK, I can absolutely assure you that every single time I meet a government minister, and I've met 4 this last week, that I point out that carers in Wales and Scotland have all had a better financial support than those in England, and I don't understand why it isn't possible to replicate that good practice. I was last time, and I remain this time, impressed by the commitments to carers expressed by those in a position to make a difference here in Wales. And this Carers Week, I've spent an inordinate amount of time with decision makers in England. In fact, I think the Minister of Care is slightly anxious that I'm going to turn up to her family christening this weekend because I spent so much time with her. I've heard a lot of supportive comments, but I've only heard long-term solutions, 10 years to fix social care. And we, as you know, have been asking for a 12-month recovery and respite plan for unpaid carers as we come out of the pandemic, because put simply, the pandemic isn't over for carers, and critically, this 12-month plan will take us through the winter and into next summer. The plans for the immediate future, and it sits alongside the more ambitious goals for carers benefits and social care and carer support. So in essence, what we're asking for is to include carers in the autumn booster vaccination programme, to make sure that testing is available for carers, investing in their mental well-being for carers. One of the biggest issues that they raised in our polling before Carers Week was their own mental and physical well-being, making sure that carers are identified by the NHS, implementing care leave, which I've already spoken about. And of course, the big price tag issue is about carers breaks and making sure that we get carers a break as soon as possible. Beyond that, of course, we would like a national carers strategy to build on the plan for carers in the medium term and longer term, as many of you will know if you've heard me speak. It's about bigger continual improvement and change to support carers, one of our aims being making it a protected characteristic. So whilst I know that every single one of us has worked incredibly hard this Carers Week to make carers visible, valued and supported, I think that we can safely say that there remains much for us all to do, and we will regroup on Monday and start again. Claire.
Thank you, Helen. I'd just like to say a massive thank you to all of the expert panel members for today. Really appreciate you coming back and feeding back what you've done against the commitments you've made. And obviously we can look forward to continuing to work with you to make those things happen. So thank you to you all. So given the time limitations at today's webinar, we would like you to encourage you to contact us if you want to raise any queries about what you've heard today, or if you're interested in working with Carers Wales to take forward the recommendations that Carers made at the Carers Summit. So please do that. If you are a carer or you know of a carer who'd like to get involved with Carers Wales' policy and campaigning work, then please do get in touch, because we have a range of opportunities for carers to do that. So in wrapping up today's webinar, I'd like to say diolch yn fawr iawn. Thank you very much for attending and for your interest in unpaid carers. Whilst the issues that affect carers' everyday lives are really vast and complex, I strongly believe that by working together, we can improve the lives of carers across Wales. Each of us attending today in this group of people can play our own role in helping achieve that. And I would strongly encourage you to take action in whatever way you can. I think it's important to say, don't numb yourself to the challenges. I know there are challenges, and I know it's difficult, and sometimes it can feel overwhelming with what we need to try and achieve, what we need to try and change. And please don't get frustrated and disillusioned with the time it takes to make those changes, because we all owe it to the hundreds of thousands of carers across Wales who are really desperately struggling with the daily demands of their caring role to be better, to strive for improvement in everything that we do for carers, and to make positive and lasting change. And just to say, from my perspective, Carers Wales will keep striving, we'll keep pushing, and we'll keep representing carers' voice in every way that we can. And we look forward to working with all of you in doing that. So thank you again for being part of the webinar today. I hope you enjoy the rest of your day. Hwyl fawr, goodbye. Thank you.